Hello friends, welcome to the YouTube channel HealthQ, the place where my mission is to motivate you to look at the bright side of the health. In today's video, I would be sharing with you some of the exercises which is meant to improve balance as well as coordination. These exercises are helpful for people who are suffering either a problem like ataxia or else Parkinson's disease or any other sort of neurological disorder that impacts balance and coordination or else disturbs the patient's ability to stabilize himself. So if you are interested in watching these exercises, make sure to stay tuned till the end. So let's begin. So basically the exercises for ataxia are of two types, equilibrium exercises and non-equilibrium exercises. Equilibrium exercises are meant to improve balance. These incorporates exercises of legs and spine. Whereas the non-equilibrium exercises are meant for improving the coordination of hands and eyes. So now let's have a look at each individual exercises for coordination. So let's now first begin with equilibrium exercises. As I mentioned, equilibrium exercises are designed to improve the balance. These exercises can be performed either lying down or else sitting or else standing. So first begin with lying exercises. So here as you can see, all you need to do is bending your leg one by one from the knee. The repetitions depends on your ability to do the movements. It's good to start with 5 repetitions for each leg, and as it gets comfortable, you can increase the repetition numbers. The next exercise that you can do after this is raising one leg at a time up and down, and try to swing the leg for 5 repetitions. After that, keep your knees bent and try to bring the hands and knee together in coordination. Remember, here the focus is not only on improving the balance but also to improve the coordination between hands and legs, which gets impacted in neurological disorders. As in progression to this exercise, you can bring your head also raised while you are bringing your hands towards the knee. This improves not only the coordination of hands and legs but also it adapts an eye coordination to the entire movement. The next exercise is to raise the hips or else waistline up. You can hold this position for some time and then come back. It's good to start with 5 repetitions and then gradually increase or decrease depending on ease of doing these movements. After this, try to raise the knee up. The idea here is to allow hip knee movement and thus improve the flexibility at the joint level. You can do this for 5 to 10 repetitions based on your ability to do the exercise. After that, you can then try to touch the heel of one leg to the shin of other leg and then drag your leg up and down. You can do this for both the sides for 5 repetitions each. The next movement to try out is the movement of ankle. So here what I am doing is tapping the ankle up and down. These are ankle toe movements which can be performed for 10 to 15 repetitions. The next exercise to do is leg tapping. So here is very simple exercise where you need to raise your leg from hip and then tap it down. You can also find it familiar to marching at the place. Next is the turn of seated exercises. The exercises which can be performed while sitting. And in that, the first exercise is to try to touch the toes and hands. This is not only a good mobility exercise but also a very good flexibility exercise. You can do this for 3 to 5 repetitions each for both the legs. Next is trying to sit up and down. You don't need to raise yourself completely up, but just try to raise yourself up, lift up your butts and then sit down again. After that, you need to shift your weights from one side to other side by moving the hands up and down horizontally, vertically and diagonally. You can also twist your spine side to side while doing seated exercises. Now let's have a look at standing exercises. Standing exercises are basically exercises where you focus towards your overall bodily balance. Here you can do marching, moving your legs side to side, and even bending your legs behind and front. These are called lunges. This you can do for 5 to 10 repetitions. You don't need to overdo this movement. Make sure the movements are comfortable, easy, and free flowing. You can also do raising your heels up and down for 5 to 10 repetitions. Other movement to do is bending your knee backwards. This also you can do for 10 to 15 repetitions. Again, the movement should be pain free and comfortable. After that, you can do mini squats where you are slightly bending your knee and bending your leg and body downwards. With this, you can also try shifting your body weight from one side to other side. This allows to improve the balance of your body. Now comes the turn of non-equilibrium exercises. These exercises are exercises that are meant to improve eye-hand coordination. As you can see in this image, here I'm trying to touch my tip of finger and then tip of nose. This is an example of a non-equilibrium exercise. You can do this for both the hands for 5 to 10 repetitions. After this, the next exercise is the pendulum movements of the hand. Here you have to move your hand like a pendulum forward and backward for 5 repetitions to 10 repetitions for both the sides. Next is stretching the hands outwards and inwards. You need to do this again for 5 to 10 repetitions. Similarly, you can stretch your hands upwards and downwards. This also brings a good quality of hand coordination which is required for an ataxic patient to do in day-to-day life. So friends, these were some of the exercises which are simple, easy and are meant to improve balance and coordination. I would highly recommend to see a physiotherapist and take a proper customized exercise program for yourself based on your individual needs and requirements. I hope that you are liking the content that we are making on a regular basis. If yes, make sure to like this video, share this video with your friends and family members or whomever you feel this video would be of help, and don't forget to subscribe to HealthQ channel. See you in another video. Thank you.